Hello, my friend. So thank you for joining us for another episode of RCRM Connections Magazine. We're thrilled to have you, Philip Boyce. I am going to go ahead and let you give your official title for today.
Well, thank you, Jenna. I'm very honored to have this opportunity. So I got one of your hats, and I'm happy to rep the enterprise today.
Thank you.
So Philip Boyce, I'm a Senior Vice President and Chief Revenue Officer for Baptist Health, which is in Northeast Florida, the greater Jacksonville area. I'm over revenue cycle and managed care. We now call it payer strategy, but those two areas report up to me.
In regards to how did you get into the position you're at? Why revenue cycle? Or maybe it wasn't why revenue cycle, because I know you've been in this position 7+ years. So a quick, tell us how you got where you're at, folks that helped you along, and your story.
Well, I've been at Baptist. It'll be 30 years this August. So 7 years ago, I started in managed care. I was VP of managed care, then got promoted to Senior VP of managed care for the system, and did that for 22 years and really enjoyed that. Prior to that, I had worked at Florida Blue in managed care contracting with hospitals. So I basically went on the other side of the table. So after 22 years, our CFO, we had a really good relationship, and I was concerned about denials that we were seeing. I was complaining some about denials we were seeing because we would negotiate these contracts, we would negotiate language, do all this work, and then to see money leaking out, the back door from denials and take backs and all that. So I started kind of complaining to him. And so one day I was walking past his office, and he said, "Hey, Philip, come here. Let me show you. I've done a reorg." I'm like, okay, not really thinking about it. So he shows me the new org chart, and he has me over the revenue cycle VP. So basically, which would put the revenue cycle under me. We didn't have HIM at the time. We do have that now. But so he said, I'd like you to run the revenue cycle. Will you take it? No more money. I wasn't offered any more money. Now, in managed care, I had a department. I had managed care, and then I also had reporting up to me, utilization review, because a lot of that work is fighting with the payers over OBS versus in and so forth. So had but that was a pretty well-oiled machine, and didn't really do a whole lot in that space. So I had about 6 people, and we were external focused, really focused with payers, small team. And so when I agreed to take it at the time, I thought, man, I can't, I've kind of been complaining about this. I can't just say no.
Yeah.
And part of me was ready for a new challenge and thought, let me see how I do. So no more money, just take it, see what you can do. So I thought, okay, to myself inside, I thought, okay, I'll give this a shot for a year and see how it goes. So I went from maybe a staff of 6 to a staff of 1,000, and dozens of departments. It was kind of crazy. So I did know that registration was important, and you needed to get the right health plan. I did know that you needed to get a bill out the door, in less than 6 months. 180 days. We had changed all the contracts to be 180 days for commercial, try to get, didn't know about coding, didn't know CDI existed, didn't really, understand too much on the back end and cash posting and just all this stuff. So anyway, so it was a steep learning curve. So did that for 2 years, just trying to get my arms around it. And I went to but I still had managed care. So I took on the revenue cycle, but I still had the managed care responsibility. So I went to as many conferences in those 2 years as I could possibly find. I mean, I just, everything, anything related. And I wanted to go to just learn as much as I could. And so to try to cut down expenses, I would say, well, I'm happy to speak at the conference, and I can talk about how I'm integrating revenue cycle and managed care, because most systems don't have managed care and revenue cycle, in the same group. They're not together. They're kind of separate silos, and we had been separate silos. So when I took the revenue cycle, the first thing I wanted to do is try to integrate managed care and the revenue cycle to help reduce denials and kind of make us more effective and more integrated. And so that was kind of a topic that people were interested in. It was the only thing I could talk about at a revenue cycle conference. I knew nothing else. So I went to many, many, many conferences, wanted to meet people, wanted to find out who's really good in this space, and find some mentors. So did that for a couple years, kind of understood my team, who's doing what, and then just trying to learn about all these areas of the revenue cycle. And then COVID hit. And that created just a whole new dynamic where, like, within a matter of 48 hours, we had to all go remote and take the revenue cycle remote. So we did that. We shut down elective services for 5 months and canceled all those procedures. 5 months later, tried to get all the people to come back. They didn't want to come back. So we went through, all of that. So just when we kind of got settled in with COVID and kind of went through that and had the services start back up, and now we're working remotely, but we're kind of back on track. Our system decided that we were going to migrate to Epic. Big bang, SBO, all physicians, and not only go to Epic, change our clearinghouse, change our bank, change, all these vendors, our statement vendors. I mean, we just ripped the Band-Aid off on a lot of stuff. So we prepared for about a year and a half to go live on Epic. And so still running the revenue cycle and, figuring out, getting my arms around it and working, in the revenue cycle. And then after a year and a half going live on Epic, which
So Epic was live 2 years ago, right? Are you?
yeah, but about little over 2 years
Okay.
ago,
That's
2.5 years. So then we went on Epic, and of course your hair's on fire for the first year. It's just wild.
Yeah.
So it really, for the 7 years, little over 7 years I've been involved in the revenue cycle, it was probably back in October, this past October 24,
Okay.
where for the first time I felt like I could actually kind of take a deep breath and
Okay.
okay,
Yeah.
like, we're okay, like, I'm okay, we're okay, like, this is going to work. So
Well, you have a great team too. And
yes,
did you inherit a lot of those team members? Did they stay with you because they were already in revenue cycle? Or did you build the team? Or have you built the team along the way? I know
so
that you're now at HIM and all of those
yeah,
things.
have a fantastic team.
You do.
Our leadership, they're awesome. So it's been an evolution over time. Some people didn't really take to me being over revenue cycle because, again, I had been at the system 22 years and I knew a lot of the people in revenue cycle that, had been there. And so, I can kind of, looking back, it's like, well, why would you put the managed care guy like over us? Like, he doesn't even know the revenue cycle. Like, what?
Right. Right.
So there were some people that didn't really take to that, and I can understand that. And then through that and through COVID and then with Epic and different things, there's been a transition and a migration, and some people really stepped up and grew in leadership. Other leaders weren't really having it for,
Yeah.
me being over it. And then other leaders, some retired and some went to do other things. And so those that stepped up and accelerated their leadership in their positions are fantastic, and they've done great. And then we've had some new leaders come that have been outstanding. So we've just put together a team that I'm really proud of. They just do fantastic work.
They do.
So
They
it's
do.
a joy, to support them.
And speaking of the team, you have a large team now. So in regards to who are your direct reports, not names, but in regards to, do you have an HIM director? What
Yeah.
departments do you have and how many?
Yeah. So, well, we have, we have 52 departments. We have 1,250 people. We have a budget of about $108 million a year. And so that's kind of the scope of it. Now,
Mhm.
that does include our managed care department,
Okay.
which again, we've really worked to integrate that in the revenue cycle. But all of the areas report to me. So PAS, the front end, HIM, CDI, hospital coding, hospital billing, physician coding, physician billing, SBO on the back end.
Mhm.
We have an education department, a quality department, an employee engagement department. Michelle Bear leads those, and we have what you've interviewed. Um, and I'm probably leaving some things out, but of course, our managed care team.
So of those 50 plus departments, are they all direct reports to you, Philip?
So I do have a lot of direct reports. I think I have 9. We have also we have a vendor management. We
Okay.
have like system access, and we use Zinc in that area. And we have a policy vendor, like I said, vendor management. So in those
Mhm.
areas. So yeah, so I have, I think 9 right now, direct
Nice.
reports, which um, keeps me busy.
Yeah, it does. So when we talk about direct reports and just we talk about the hybrid models, we talk about the completely remote. Do you meet with your teams in-house? Are you completely remote? How have your relationships, how have you been able to maintain those relationships? Because you are very kind and I know that you like events and people. And so
Yeah.
how have you done that?
Yeah, it's been a real balance. So we're pretty remote. I mean, other
Hmm.
than PAS on the
Right.
campuses, and we do have then some PAS call centers, but
Okay.
those are, some of those folks are remote. Some of our customer service is remote. So we're probably at least 70% remote.
Okay.
And so we really work hard to try to have opportunity for and when I say remote, most everybody's within a 50-mile radius of
Sure. Sure.
Jacksonville.
Oh, okay.
We,
So you have a lot of Floridians then.
yes, we
Yeah.
have a lot of Floridians. We do have some out of state, but mostly it's, when I say remote, we're either less than 50 miles, a few are more than 50 miles, but almost everybody can meet in person geographically based
Nice.
on where they live. So we try to have a lot of events, and we created an employee engagement department,
Mhm.
and where we
Oh,
focus
nice,
on having
nice.
those events. We have a monthly mingle. We meet with new employees every quarter for the new employees that come on every quarter. And of course, each of the departments will have in-person staff meetings maybe once a month. So we try to do enough where um, people can be together in person for what that brings. But most people, most enjoy being able to work remote and not having to come into the office every day.
Sure.
Some will come in, some departments, they'll come in one day a week. It kind of just varies based on the job. So I feel like we have a good balance. Few people are always going to come on site every day just because they like that.
Mhm.
Some people don't want to come in at all. Most want some sort of a hybrid situation, and then we just try to supplement that. We have a fall festival, which is really fantastic. Monthly monthly mingles, which are after work from like 5:30 to 7:30, and we provide
Fun.
some food. And anybody from the we do it at all different areas of Jacksonville, because Jacksonville is very large
Mhm.
geographically. So we have it in the different areas of the greater North Florida area, so that it hits where some people can live where they live, and so they can attend.
And last question I have for you in regards to Jacksonville. We talk about Jacksonville and we talk about the influx of patients. We talk about the influx of talent and employees and things. I know that Baptist is very entrenched in Jacksonville. So, talk a little bit about the charities, the events, and Baptist in regards to Jacksonville, the city.
So we are probably, I think this is our 70th year uh,
Wow.
coming up. So we've been in Jacksonville for a long time, but we're the
Mhm.
only locally based, locally governed health system in our region. So
Okay.
we have University of Florida here, and they're based out of Gainesville. We have Mayo here, based out of Rochester, Minnesota. We have HCA here, based out of Nashville. We have Ascension here, based out of St. Louis. So Baptist is just the local, we're our board, our local leaders,
Mhm.
and we just have a real community focus, and we answer to the people that live here basically. So that's unique for Baptist. That sets us apart. We have the only children's hospital,
Mhm.
so that's also another unique feature about Baptist. We have the only full behavioral health program. So we're in OB, we're in children, we're in the psychiatry and psychology, kind of those areas that don't make money, frankly, lose money, need to be supported, but we're committed to those services, whether there's any margin or not, because the community needs those services. So
Okay.
we're committed to serving the community, and so we have strong outreach program, and that's been something that's been part of Baptist. So, like I said, it'll be 30 years for me in August, and
Wow.
it's been like that
I
from
love
day
that.
one. So
I love that. In regards to some of your charity events as well, Philip, some of your golf events and the charity, the give back from Baptist to the community, to community leaders, to patients, it's incredible. So,
we have a whole kind of community uh, area that focuses, and we coordinate with a lot of other organizations in town to supplement and work with each other. And so yeah, we do a lot. The Children's Hospital, as you can
mhm.
imagine.
Anything I missed? I always like to ask this question and give you an opportunity to about your story, your family, your employees, your city. Anything that you'd
Yeah,
like to just
well,
kind
I
of
guess
leave with?
two things. I mean, certainly going back to my leaders, my staff, our staff, um, just how amazing they are, how committed they are. Just they're pretty incredible. So it's a privilege to work with them and to watch them grow and see them in their different areas, and then collaborate together. Bringing managed care and bringing revenue cycle together to, and I understand the managed care mentality. That was my world. And as I got into revenue cycle, it's like, boy, this is like a Mars and Venus thing. I mean, I can
Mhm.
understand where, the managed care people really don't understand the revenue cycle. Revenue cycle people go are like, well, just tell the payer to do this. They don't understand.
Yeah,
So
the contract. Yeah.
really working to try to integrate payer strategy and revenue cycles so that together as a team, the payers can't divide and conquer, number one,
Mhm.
and we can really support each other and just help the enterprise more by being one unit. So I have focused on that for 7 years. That's been kind of one of my, things that desires that I've had in terms of being in this position. I don't come at it from this tremendous revenue cycle background like most people do. So that's been an area that I feel
Mm.
like I could be effective in. The other thing I wanted to say is like attending a lot of conferences in the first 2 years to just try to learn about revenue cycle and then find out who the leaders are across the country. The revenue cycle leaders in this country are amazing.
They are.
It is, as you know, it's a
They are.
community of caring people. Number one, if you're a revenue cycle leader, your own organization doesn't really understand what you really do. They don't
Right.
really, the
Yeah.
clinicians don't really understand revenue cycle, right? So they don't understand the complexity. So even within your own organization, you're not really understood. And then you have a very difficult, complex job, and then you have, those patients that are having issues that you're always
Mhm.
having to deal with, and so it's a tough role. And so there's just this closeness and this camaraderie. And I have just found revenue cycle leaders across the country so willing to help, reach out, offer assistance. Like I would say, like I'm a rookie. I don't really, understand this or understand that. And they were just so willing to assist, which just kind of surprised me. It was like, astounding, like, wow, like they really care. how I'm doing and how I do. And
Mhm.
so just, meeting that community, I owe them so much, really being able to um, do this job and kind of get my arms around it and survive in it, quite frankly. I owe a lot to my peers around the country.
So,
There's just some incredible, outstanding leaders over revenue cycles across this country. And, without the revenue cycle, the clinicians can't carry on, right? And so
right.
I kind of see the revenue cycle as a foundation, as a support, it's a support area for the clinicians doing what they do, and the hospitals doing what they do. And you have these amazing revenue cycle leaders kind of undergirding our health system across the country. And it's pretty remarkable.
Well, you're one of them, my friend. So
Mhm.
to agree to this and to sit down and, on a Friday afternoon, I sure appreciate you. You know that.
Well, thank you very
So
much, Jenna. I
so
appreciate
thank
you too.
you.